Now to that interview that we mentioned earlier on, and His Highness the Aga Khan has left an indelible mark in the lives of many people and across the socio-economic sphere under the Aga Khan Development Network, which has under its wings initiatives cutting across healthcare, education, financial institutions, tourism, to name just but a few. Amin Mawji, the diplomatic representative of the Aga Khan Development Network, accredited to Kenya and Uganda, sat down with NTV senior reporter Ibrahim Karanja for an interview.
His Highness was a tremendous leader. Having worked and observed leadership in many different contexts, I was remarkably struck by his style of leadership and the nature of his leadership. I mean, there are two things that really stand out for me in the way he operated. One was that he was a leader who never tried to tell you an idea. He would try and sell it to you. He would make the case. And the second thing that always struck me about him was that he always thought very long term. I remember there was an opportunity when I had first given him what was a 5-year plan for something, and I told him this is a medium to long-term plan, and he laughed. And I realized afterwards that the reason why he must have found that very funny is because he thinks in terms of 50-year intergenerational cycles of planning. For him, 5 years was a short-term plan. So we learned a tremendous amount from him, both in terms of his vision, but also in terms of his leadership style.
This is a person who leaves a great mark in the world. How would you say he contributed to this, in terms of his social impact in the globe? I was speaking about what he did in terms of development initiatives in the country, as well as what he did in education and health.
Well, I think the place to start is to recognize that His Highness's principal role is that as a spiritual leader. He is what we refer to as the Imam of the Shia Imami Ismaili Muslims. And His Highness always saw it as a duty of leadership in Islam to look after the social welfare, to look after the quality of life of people of all communities, irrespective of their faith, their origin, their gender. And so if you look today at the social development programming that His Highness initiated in East Africa, you will see that these are, and have always been, open to everyone. This may sound perhaps not particularly remarkable today, but remember many of these programs started in 1905, 1906, colonial times, and to have had started schools in those days that were open to all the wananchi, that took teachers from all different sections of society, was a remarkable thing. And it showed the direction that he was taking us all in, which was to look after social development for humanity, not just for any particular community or tribe.
What is it that really inspired him? Yes, you've mentioned that he was a religious leader, but there must be a drive, perhaps even connected with his young life. What is it that inspired him to want to have such impactful legacy to the people of Africa and the people of the globe?
Yes, no, it's an important question. And His Highness himself often spoke at length about this issue to explain to people that he was doing this work not because he was a philanthropist. He was not doing this work because he thought he should be providing charity. He tried to make it very clear that he saw this as a duty of leadership in Islam. So he was a leader in Islam, and to him, it was not a question of trying to be a good person or a benefactor. It was a question of fulfilling his duty as a leader. And so every time he decided to start a program, he saw that as a duty, that there are people today in these communities who are underserved or underprivileged. It is our duty to help them. And that was his driving mission. Unfortunately, a lot of that gets lost in some of the descriptions about him, which are in terms of describing him as a philanthropist. But that's not really an accurate way of looking at the motivation that led to the great work that he led.
Off my mind, I quickly can point out to some of the impactful initiatives he had. With the organization I work for, Nation Media Group, was founded by him, in healthcare, several hospitals, in education. Perhaps, would you tell us and tell our viewers specifically the various initiatives that he's had in Kenya, in East Africa, and also in the continent?
Yes, I think that's important, because each of the programs that he led were programs designed for their time and their place. So if you look back at the time when the Aga Khan first started here, really it was his grandfather as the previous Imam. And the Ismaili community settled here. Around 1899 was the first time when the previous Aga Khan visited, and decided to have a few members of the Ismaili community settle in East Africa, starting with Zanzibar and then Mombasa and so on, because they came on the coast. In those days, it was clear to the Aga Khan that what was needed was quality education for people. The driver for development, he felt, was going to be education. And so the very first Aga Khan school started in 1905. And it's important to mention that because it started very soon after the community first settled, but more importantly, it started as a girls' school. And that tells you something about their thinking, that this was about empowering all children, but looking at those who were particularly in need of empowerment. And so the first schools were for the girl child.
Where was this?
And started in Zanzibar, and then Mombasa and so on. That was in the 1905 period. By the time you get to 1920s, it was clear that what was also needed, given the colonial context, was access to healthcare for local wananchi. They were not able to access proper healthcare. If you were a local wananchi in those days, you could not go and find a dentist to serve your needs. And so the first Aga Khan clinic opened in 1920. Today, of course, everyone knows about the Aga Khan hospitals, but it started from that origin of saying, let's develop and bring healthcare and give access to local people to healthcare. That was in the 1920s. By the time you get to the 1930s, what was becoming clear was that we needed to expand financial inclusion to the population at large. And so the very first insurance operation in East Africa was started in 1936. It happened to be the golden jubilee of the previous Aga Khan. And so that insurance program was called Jubilee Insurance. Not surprisingly. We are not very creative in our naming, so it was called Jubilee Insurance. And then by the time you get to the 1940s, he felt, the Aga Khan, previous Aga Khan, felt that it was necessary to expand financial inclusion through banking facilities. And that happened to be his Diamond Jubilee. And so we started something called Diamond Jubilee Bank, Diamond Trust Bank.
At the time, Diamond Jubilee Bank.
It was started as a Diamond Trust investment unit, but today Diamond Trust Bank.
Yeah, sure.
So that kind of brought us up to the time when we went through a transition to His Highness the Aga Khan, who became the next Imam. And when he became the Imam, which was in the 1950s, the region was getting ready for independence. They were preparing for a post-colonial world. And His Highness felt very, very strongly that it was important to help all of these fledgling governments and countries to make the transition to a post-colonial world. And somehow he felt that one of the things that was important in the new democratic construct was to have a free media, a free press. And so in 1957, we have the Nation Media Group being formed. And the principle behind the Nation Media Group was to give to the wananchi the tools through which they could be better informed, better educated, better entertained. But the idea was to create a very vital organ of any democracy, which is a media house, both press as well as broadcast. And so that's how we get into the Nation Media Group in the 1950s. By this time, of course, we were also seeing transition in the governments, going to more independent countries in the 60s. And one of the conversations that the leaders of East African countries, Kenya, Uganda, Tanzania, were having with His Highness was, you know, how can we try to become more stronger economically? Now, we've been talking a bit about the social development.
Social impact, yeah.
But by this time, the conversation was moving into the broader subject of how do you provide economic development. And so His Highness started a program called Industrial Promotion Services.
Industrial.
IPS. The building that we're in today is called the IPS building. And people sometimes forget what IPS stands for. It's the Industrial Promotion Services program. And the idea of that program was not to just acquire scale. The idea was to demonstrate how different industries could actually start. So His Highness started many different industries. Packaging, leather, textiles, pharmaceuticals, agri-processing, fish nets. All of these ideas, all of these small programs that started small and grew were designed to demonstrate that it was possible to do this in East Africa. It was possible to do it at international levels of quality, but also to help the governments to determine the industrial policy for these sectors. So remember, these were new sectors for East Africa. There needed to be a proper tariff policy. There needed to be a proper regulatory framework. There needed to be some industry standards. What the idea was of His Highness was, let's start this industry, each of these, to help the government to write the industry standard, to help write the tariff policy, to help write the compliance with the regulatory framework. And so IPS started that way. And then, of course, you get into the 1970s. So by the time we get to the 1970s, His Highness was very seized of the opportunity that tourism provided as a sector for development. And so he managed to work with the three governments in the region to get them to adopt a policy that would encourage tourism. And so he started a program called the Tourism Promotion Services, TPS, and then TPS had a brand name called the Serena. So if you were a tourist coming from Europe or the US, you would have a good 5-star hotel to stay in Nairobi, the Serena, or Dar es Salaam, or now more recently in Kampala. And if you wanted to go to see the lodges or the game parks, there would be Serena lodges across East Africa. And so the idea was to really help promote tourism by providing a standard of service, hospitality service, that would encourage Western tourists to come. And His Highness was uncompromising when it came to quality. You know, his view generally on everything was that, don't ever tell me it's good enough for Africa. It's got to be good enough for the world before we do it here. And so that was his basic principle. And so when we look at the Serena today or the lodges today, you see that being reflected in their origin.
Many years down the line today, how widespread are these initiatives in the globe and in this region?
Well, let's just start with this region first of all, because development did not stop with just the tourism and the industrial promotion. What was becoming clearer to His Highness was that you also needed to provide some of the enablers. And in those days, I'm talking about the late 80s and 90s and the early 2000s, technology was a key enabler. But this part of the world didn't really have good internet access. And so the very first broadband cable that brought the internet to Africa is an Aga Khan program. It's called CCOM.
Tell us about that.
So CCOM is a fiber optic cable. It's a repeated system that brings fiber optic cable from Europe and Asia and lands on the east coast of Africa. And from there, the network goes to Tanzania, Kenya, Uganda, further south. And it transformed internet access. So in Kenya, for example, internet access went up by 95% because of CCOM.
Wow.
Right? So this is an example of if you like, a development program that was trying to meet a particular need in this region.
Yes.
There are a couple of other small examples I can mention. There was a time, for example, when some parts of the region didn't have enough energy generation. And Uganda is a good example. And so at that time, they used to get load shedding. You're probably too young to remember what load shedding is, but there was load shedding for 12, 14 hours a day in Uganda. Yes, load shedding is when there isn't enough generation of electricity, and so the power goes off.
Okay.
The power goes off, and then people have to use either batteries or generators, use other fuel. And so there may be a few hours in the day when you don't get electricity. That's called load shedding.
We needed that explanation for our younger audiences, yes, including myself.
Okay. Well, there were some parts of East Africa where we had long periods of load shedding. What the power station in Uganda did, as an example, it's called the Bujagali Power Station, is it provided a 250 megawatt supply of hydropower that stabilized the grid, and up until very recently provided 46% or 50% nearly of Uganda's energy needs. Now that's an example of a program designed to meet a particular need for a particular region.
Sure.
His Highness is also keen that we do the next one. I mean, we've done several power projects, but the one that's being worked on at the moment under his direction is a program that deals with power generation for Rwanda, Burundi, DRC, for example, because again, there is a section of those three countries that doesn't have access to energy. And so this program will be designed to do that. I give this to you just as examples of the kind of development work that His Highness was promoting.
And you have clearly stated that he started specific initiatives,
yes,
then again started enablers to ensure
yes,
that these particular initiatives work, and that's why I asked, so how widespread are they today?
I think we can see examples of this type of activity in many parts of not just Africa but Asia. And there have been some very unique programs that His Highness started which have transformed some regions through these initiatives. I think I would draw out a couple of things which are characteristics of this type of thinking. The first is that His Highness always takes a very long-term view. So when there was a need to have a power project here, other investors looked at it, clearly. But other investors were not willing to take the risk.
Yes.
And were not certain that they would ever get their money back within a reasonable period of time. What was different about the Aga Khan was that he took a very long-term view. It is what we call patient capital. He brought in the funding and was patient with it to say, one day this region will come up and let us help them to get there. So this was an example of an approach that led to that project. The other point I think worth making is that His Highness was very keen to make sure that in each case of programmatic work that is done in East Africa, it was done in a partnership with the governments. So the idea was not that somebody sitting in Europe or America would come in and say, you need this and you need this and you should do this. No. In each case, the idea was to sit with the government, agree what the priorities were, and then decide where to put the investment, so that it was done as part of the government's overall development program, not in competition or not in replacement, because His Highness has always taken the view that there are things that the government is best to do and only government can do, and we should support the government to do that. And there are some things that the private sector can do and only the private sector can do. Let the private sector do that. But there are some things that civil society can do and can do it very well. So let us, Aga Khan Development Network, as civil society players, do the things that we can do best, so that we are part of the overall development of a region.
There were very well-meaning intentions in these initiatives. Looking back, many years after all these initiatives were set up, would you say that they have lived to the expectations that His Highness had for all the projects that he has had in the region and in the globe?
His Highness was a person who was in a way always looking to improve. So, you know, he believed in this idea of continuous improvement. He would have answered your question, I think, by telling you that there was never a time when we stopped and said, okay, we've now achieved what we want to do. But if you look at the impact of what has been achieved across the network, today the healthcare system, I told you it started in 1920 with a clinic.
The clinic.
The healthcare system today in the countries where the Aga Khan works touches 14 million patients every year. 14 million patients every year. If you look at the education system, that system touches 6 million learners every year, working through 200 schools. And the idea of all of this programmatic work is that it is dealing with, particularly on healthcare and education, is dealing with human capital development. But as I was saying to you earlier, His Highness was not content to just stop at human capital development. He felt that you also needed to have economic empowerment and economic development, which is why, alongside the human capital development, you have all of these sectors, whether it's power generation or aviation, as used to be the case here in early years, or telecommunications, or agri-processing. Each of these was a pioneering effort to try and strengthen the economic base of the nations. And so those have been the kind of distinctive approaches that he brought to the way development is being done.
Would you know how many lives His Highness the Aga Khan and his initiatives impacted directly in terms of, and this is globally, in terms of provision of jobs,
yes,
and also indirectly with the very many initiatives that he had? You've already mentioned in the region 14 million patients through the healthcare system that he set up, 6 million learners across 200 schools. But other figures in terms of direct impact?
So I know that's a good question. I won't go through country by country, but if you take one country as an example, perhaps in Asia, if we take, let us take Pakistan as an example, the impact on the GDP of the country runs into over $1 billion. Now, I could mention to you the number of patients and the number of students and so on, but then you've got to sit back and say, what is the economic impact for the nation as a whole? Because remember, each of these things has a multiplier effect.
Yes.
Right? You cure a sick person and get him back to work, there is an economic benefit of that. You train a child who then becomes a doctor, who then saves many lives, you have an economic impact of that. So the last estimate that I've seen, for example, for Pakistan, was over $1 billion worth of GDP annually impacted by the work of the Aga Khan network there. And there are similar stories in Afghanistan, Tajikistan, East Africa, Kenya, Uganda, Tanzania in particular, where the multiplier effect has been quite significant.
Great. Let's come back here and speak about something that we all hold dear, and this is the Nation Media Group, and the thought behind establishing the Nation Media Group. Like you said, at that particular time, it was also to help into independence for the East African countries at the time. Looking back, do you think this media giant in the region has also lived up to expectations?
Well, I start from the point I was making earlier, which is that His Highness was never satisfied with where we were at any point in time, because he always felt that there was room for improvement. Now, you ask about the Nation Media Group. The principal philosophy behind setting up a Nation Media Group was to make sure that there was good quality journalism that would inform people and educate them, but would be independent. It should not be a media house that was controlled by a proprietor who had self-interest at heart. And so His Highness put in place two things. He put in place an editorial policy that tried to make sure that the proprietor was not influencing editorial policy, and that the Nation Media Group's own management were responsible for enforcing a policy of independent reporting. And the second thing he tried to do was he set up a graduate school of media and communications to try and help lift the standards of journalism. Now, do I think we have achieved both of those fronts? I think the answer is no. I think there is still some way to go. before we can say we now have very good quality journalism, and where we can say our journalism is totally objective. I don't think we are there yet where we can say that. So the ambition is to have achieved that. And I know that, you know, if you were asking His Highness today, he would say to you, we should help people to get to that point.
What is the future, and what guidance do you pick from His Highness the Aga Khan that will still guide the operations of the network?
So I think, you know, His Highness's view was always that the world we are living in is changing constantly and is changing very fast. So if you look at the areas where the development network has been operating, let's take healthcare as an example. The disease burden today has changed quite a lot from what it used to be. There was a time when the real issue of healthcare here was what I would call infectious diseases, whether it's malaria or HIV and so on. Today, we are seeing an increasing burden, disease burden, of non-communicable diseases, diabetes, cancer, blood pressure. These are diseases that need a different kind of treatment and a different kind of preventive program as well as a curative program. And so what we are likely to see, if you look at our programming, is an increasing shift to invest in improving healthcare or helping to build healthcare capacity to deal with non-communicable diseases. That's an example. On education, again, you'll see the world that we're living in is changing. It's becoming a much more digital world. There is a need to educate people on the digital economy, but equally there is a need to educate people on the environment, because we need to start getting serious about, you know, how we build environmental resilience, how we deal with the effects of climate change. And we are not yet at that level where our schools are on top of educating these subjects. And so the Aga Khan Development Network is investing effort and time and resources to see what we do to improve education in these areas. Those are examples of how the world is changing and how the development need changes with it.
I agree with you. You mentioned about some of the initiatives that His Highness, and this is my last question, was very keen to ensure that we achieve, including the energy needs of Rwanda, Burundi, you said. What other initiatives was he desirous of in this day and age? Because of course, as technology advances, as time advances, the needs are different.
Yes.
And the challenges are different.
Yes.
What other things, what other initiatives was he desirous of?
So I would mention a couple of things. One is, if you look at healthcare today, the genetic makeup, the genetic profile of our citizens here in Africa is different from the genetic profile of people in Europe or North America. And yet a lot of the research that's going on to develop medicines or to treat particular diseases are being done in the West. Now, we need to have somebody in Africa who is looking at the genetic profile of people in our societies and making sure that the medicines we develop are treating our people. So when COVID came, the vaccines were developed outside. We had to get trials done here to make sure that there were vaccines were effective for our people. All that work was done, you know, through organizations like the Aga Khan, who did the clinical trials. And today, a lot of research work is happening under the direction of His Highness on looking at the disease burden of Africa and finding treatments that work for us, for our people here, whether it's non-communicable diseases or whether it's mental health, which is another growing challenge. And again, because it tends to be stigmatized, not enough people talk about mental health, or not enough people want to have it addressed. And so we are putting a lot of effort today in East Africa. We have a research program going on in Kilifi, looking at mental health issues and how we deal with that. That's one example. The other example that I mentioned is the environment and the need to protect the environment. Again, we need to look at our environmental context, before we start coming up with solutions. And so we have a research program for East Africa around Arusha that has about 4,000 acres of land where environmental research is being done in partnership with some of the leading universities to look at the effect of hydrology, pollinators, and so on, so that we are dealing with environmental resilience in our region. And then when we talk about healthcare capacity and building that, we are inevitably dependent on many medicines that come from the West or sometimes from the Far East. What we are keen to do, and we have a program that started this, is to build pharmaceutical manufacturing capacity here for our people, so that we don't have to start importing expensive products from other parts of the world, and that we can make these products in East Africa for East Africans.
And that will be a very huge, impactful initiative that will be coming from the network. And of course, that is the best place to wind up this particular interview. And thank you very much. Amin Mawji is the diplomatic representative of the Aga Khan Development Network, accredited to Kenya and Uganda, of course, granting us this interview in light of the sad news that came out of Lisbon in Portugal this morning about the passing on of His Highness the Aga Khan, the 49th hereditary Imam, or the spiritual leader of the Shia Ismaili Muslims. What an account, what a story about the socio-economic impact, because we started with what were social impacts to what were economic impacts, and a story and a person and memories to really cherish for days and years. My name is Ibrahim Karanja. Thank you very much for watching. Thank you very much for keeping it on TV, even as the world and leaders continue to send in messages and condolences over the passing on of His Highness the Aga Khan. Thank you for watching.
Thank you very much, Ibrahim Karanja, and that interview brings us to a close. NTV tonight, on this day when we have had the news of the passing on of the Aga Khan. And just a point of reminder, there has been the transition from His Highness the Aga Khan the 4th to the 5th, and that is Hazar Imam, that is Rahim Al Hussaini,